Chris. Well, thank you very, very much for being the very, very first interview.
Woohoo! This is Chris DeVolanu with Comprehensive Healthcare. I'm the Vice President of Outpatient Services. You're listening to Mental Health Monday on 107.3 KFFM. It's our 50th anniversary. Comprehensive started here in Yakima, and 50 years ago, we were just a small agency that was underneath the health department outside the county jail. There's been so much that's gone on for Comprehensive over the last 50 years. We've had so many changes, increases in the number of types of programs and services, and where we provide services at. But even though we've had an expansion of services, there's still a lot of stigma around addressing mental health and substance abuse. And we want to make sure that people understand that getting help is essential. More important now than ever, this pandemic has affected everyone across all lines in our communities, and we want to be able to support them. We need to be able to address issues around substance abuse and mental health and domestic violence and make sure that people get the support they need. We can do better at destigmatizing mental health and substance use disorder topics, but it's got to be a conversation that we have at a community level, and we're really hoping that this is our 50th anniversary and we have the opportunity to really draw attention to the great things that have happened, but also the opportunities that lay ahead of us. Everybody in our community needs the same opportunities to be successful, and it's got to be a community effort. We can't do this alone. So as we celebrate our 50th anniversary, we want to really make sure that we're bringing attention to the issues that are still ahead of us, and we're looking for the community to be a part of that.
Well, congratulations. 50 years is something to definitely tip your hat at.
We have offices in Cle Elum, Ellensburg. We have offices here in Yakima. We have inpatient treatment facilities here in Yakima. We have clinics in Sunnyside, Goldendale, White Salmon, Tri-Cities. We have offices in Pasco, and we have offices in Walla Walla as well. We provide services all across Eastern Washington.
Basically, you're covering all facets of mental health. And this month, we are focusing on Human Trafficking Awareness Month, and you have all of the tools to assist somebody if they are aware of somebody who is being trafficked or they suspect something.
That's correct. One of the things that's important is that it's not always the individual that has the opportunity to say that they're being trafficked or that they're not able to talk about the situation they're in. It's community members that create that awareness and are able to draw attention to it. So having someone from the community call Aspen and say, hey, we've got someone that I'm really concerned about them being trafficked. So that's one of the best ways that we can draw attention to it, is really supporting people in the community to reach out, talk to Aspen, and be able to draw attention to something that's going on. We have our methadone clinic. We have multiple supported housing projects. We have our Vista del Sol program in Sunnyside, which is a HUD housing project that has 12 units of apartments. Got other housing services here. We have a nursing home, assisted living programs that we're working on with the police on crisis intervention.
If anybody's having a struggle with their mental health or a question about mental health, is this all stuff that they can call you for?
That's a great question. People in crisis can call us 24 hours a day. Our crisis number is 509-575-4200.
So I see the crisis line for everybody is 1-800-572-8122, and everybody can find out more information at kffm.com. Is it pretty simple to listen to the prompts and then they can kind of figure out where they need to go?
Yeah, they can call in the 575-4200 if they have a crisis. They can call our main line, which is 509-575-4084, and that'll put it in touch with someone who can assist them. We can provide screening. One of the most important things that we want to do going forward is really looking at what we can do to increase access for people. That we want to get people into services who need to get in, whether it's for counseling, substance abuse, or other services, is to try and provide access. And having them call is usually the first step. So they can call our main number, which is 509-575-4084, and we'll be put in touch with someone who can answer questions for them. Call. Start by calling and asking questions. If they're worried about whether they're depressed or they're anxious or they're having issues around domestic violence or isolated or worried about becoming homeless, call and talk to one of our staff. That gives them an opportunity to talk about what the resources are. Then we can help find what is going to be the best resource for them. We can answer questions regarding insurance coverage or healthcare coverage coverage. That's part of the service that we provide. More important that they reach out and have someone that they can talk to and be able to answer questions for them.
So I see in January that it is Human Trafficking Awareness Month.
So this is a really good time to talk about this. I mean, we have the whole issue around the pandemic, which has really brought up issues around natural disasters. Conflict and worldwide pandemics can increase opportunities for traffickers to exploit vulnerable individuals. And anyone can be a victim of trafficking, but some are more vulnerable than others. And according to the U.S. Department of State, those populations are at higher risk of human trafficking. In our system, things that we look for are like children in welfare, juvenile justice systems, foster care, runaways, homeless youth, unaccompanied foreign national children without immigration status, individuals seeking asylum, talking about Native Americans and Alaskan Natives. These are some of the populations that can get involved in human trafficking. LGBT individuals and victims of domestic violence are all at risk. You know, if someone feels pressure to stay in a job or situation that they can't leave, or they owe money to an employer or recruiter and not being paid what they're promised or owed, those are some examples. Individuals that don't have control of their passports or other identity documents, or are threatened that if they go to talk to someone that those documents may not be returned. We want to be able to draw attention to it during this month and really create that awareness.
On top of awareness, if somebody's listening right now and they're like, ooh, that kind of ticks off a lot of my boxes, or somebody that I know, what would be the steps that somebody would report these things?
Yeah, we have a program called Aspen, which is our victim services program. They can contact Aspen at any time and be put in touch with an advocate who can help them to address this. They would be able to help talk about what their options are and ways in which they could potentially have someone to support them and protect them.
Do you have access to that number that you could give people?
Yeah, 509-575-4084.
In 2022, if we've got some issues, we should start by calling Comprehensive Healthcare.
Yeah, start by calling. You can go to our website, you can send us a message, and we're able to follow up on those things. We want to do our best to engage people, and it starts by being able to answer the phone and being available and talking about what the resources are. People are hesitant. We want to make sure that they have someone that they can talk to and talk about available resources.
So don't be shy.
It's a new year. So many people are so worried about New Year's resolutions, and right now we just want to tell people, give themselves some grace, give themselves an opportunity, because no year is the same as the year previous. Give themselves the opportunity to be optimistic and have hope and reach out to community resources. Talk about what their needs are and look at what they want to do to set some goals for the next year, and not get caught up in saying, well, here's my resolution. I failed to do it last year. Nothing's the same as last year. Every year is different. So give themselves some grace. Do something that really gives them some hope. Start by reaching out, talking to someone who can provide support. Anyone can call 509-575-4084, and it will be placed to the office wherever they reside. Our Aspen services are in Kittitas and Yakima counties. All the other resources are available for everywhere we serve. We provide counseling, behavioral health, crisis services, intensive services such as WISE that are really focused on younger kids and adolescents. But we have services for all ages and all people.
Thank you for having this, and congratulations. I mean, 50 years is a long time.
Every year is better than the year before, and we're hopeful. So that's the key. 50 years has really given us an opportunity to have a big impact. We're ready for the next 50 years.
We're excited to spread the word with you. So thank you for doing this and taking the time out of your busy schedule, because mental health is so important. So I feel like kicking off every Monday with some information is going to be beneficial to everybody.
Awesome.